It's just like a little bowling ball.
Yeah. It is a little bowling ball. I can't wait. She's gonna be
was
such
so upset.
Hi, my name is Nicky Dawkins. I am a full spectrum doula. I've been an official doula for about almost 3 years now.
Oh my gosh.
You see her lips?
Yes.
A doula to me is support, basically. I feel like that's the best way to describe it. We're also an advocate. So we're really there for the person, the birthing person, to make sure that they get the best birth possible with the least intervention as possible. A doula is everything from fertility to postpartum. So depending on whatever your needs are, there's a doula for it.
Let's kind of focus on, your womb health, your overall health, and then it'll happen. Two things were my inspiration to become a doula. First was postpartum health of mothers. I had friends who, it seemed to me, barely made it past the delivery, whether it's blood pressure issues, and I wondered how were they being cared for, or postpartum anxiety or depression. But then what really caused the flame to get higher was learning more about the Black maternity death rate. What shocked me most about what I learned is that it doesn't matter how educated you are, what your income bracket is, whether you had insurance or not, whether you were younger or older. None of it mattered. The defining factor was that mother being Black or a mother of color, but Black especially. And so that was troubling.
There's something to be said about the comfort and it's like having your mom there, but she's an expert on giving birth. One of the things when you give birth, and I didn't know this because I'm a first-time mom, is that there's not really anyone there for you. So you're there and the nurses are kind of popping in and out, but really they're just there to do technical medical things like check your blood pressure and things like that. And then they pop out because they have other patients they're working with. And the doctor, the doctor also isn't there. The doctor basically comes in when you're getting your epidural and also when it's time to actually push. So the whole time you're there, you're essentially by yourself with maybe your spouse or your partner or whatever. And when the doula came, it just gave me such a level of comfort. She, just her light stroke and comforting touch. With her help, I was able to tolerate a lot more pain than I think I would have been able to. And I think I would have just been freaking out if she wasn't there, because part of what she did was really help to calm me and relax me and feel protected and feel safe and stable.
Yeah, I would want to go more the natural route this time around. Especially
if someone is there and educated in those moments where it matters, if you don't feel well and a provider is not responding to you, that doula can help stand in the gap for you.
I'm not gonna push right now because we don't want you going to labor right now.
Because it's about education. Sometimes we just don't know that we have the right to say no, that we have the right to go to someone else who's going to respect us, who's going to listen to us, who's going to see about us, as the old folks say.
Black women, we're at a higher risk of death in the hospital. So I know it's like, okay, I got her, she got my back. If anything was to happen, I know she got my back.
Okay, yeah, so when you're, this is another one that you guys can do. For me, I feel like I want to get the mom as early as possible. Like the moment you find out you're pregnant, I want you to call me. Because the sooner that we know you're pregnant, the more we can help you along the journey, because sometimes things change. Maybe you become high risk, maybe you're gonna have twins now, maybe you can't do a birthing center and you have to do it at a hospital, or vice versa. Maybe you change your mind. A doula is there to kind of support you along the way, and also if you experience a loss or anything else going on in your family, maybe you have a divorce, we're there to kind of help you navigate your emotions, how to navigate your body physically, and just to educate you on yourself. And I feel like prenatal, that would be our focus. And then postpartum, is a big area that and that's my specialty. I feel like that's where I find the most rewarding. Let's see if I can get her other nail.
Having a postpartum doula, it's been great because I work from home. She's here in my home with my baby. And as I'm working, you know, she'll bring her to me to breastfeed. So I'm breastfeeding on demand. And she's extremely helpful.
Look at that pretty girl.
So you can imagine being around her every day and having her help. She's really teaching me so much, and I'm learning. And whenever I have questions, I ask her, and it's just so comforting.
At least for me as a doula, and I tell all my clients this, I'm like, I am very hard to get rid of. Like, once you become my client, you're stuck for life. I'm always gonna check up on you, and I'm gonna be at your kids' birthday parties, and you know, we're gonna keep talking, and when you have your next baby, I'll be right there again. So I feel like as doulas, a lot of us are doing that. I know for me, I always build a community out of my moms. I have postpartum workshops, I have gatherings, I have circles.
You must have 10,000 pictures. Our grandmothers grew up in a time where they didn't really live and travel far away from their initial communities. So when a woman had a baby, you had Auntie so-and-so, you had grandma, you had the neighbor that's known you since you were 2 to help you and care for you as the woman once you've had the baby, and you had support to ask questions. So you need a trusted person, and I would just want to give that community back to each of the moms that I deal with over my career as a doula.